Today we face an issue that's already affecting many countries in our hemisphere, including our own. It's not partisan in nature. The growing threat of the Zika virus is a full-blown public health crisis in the United States is a clear call to action. Just look at the statistics. As of July, 65 countries and territories have reported evidence of vector-borne Zika virus transmission. What's even more troubling is the fact that 4 countries are classified as having possible endemic transmission or have reported evidence of local vector-borne Zika infections in 2016. As much as Zika remains a threat on the international stage, it also poses a real and timely threat to our country. That means in these countries the disease that has already spread rapidly and made its way into the population. We're seeing this as well in the island of Puerto Rico. And Puerto Ricans, as you all are well aware, are American citizens, and Puerto Rico is an American territory. According to the statistics from the World Health Organization, the United States is one of 11 countries with evidence of person-to-person transmission of the Zika virus. That means that our neighbors, our friends, our families are already at risk, even without mosquito-borne transmission, though that is likely coming as well. As the threat of the virus continues to grow here, I will continue to state the importance of moving quickly in response. I strongly believe that inaction on Zika is simply inexcusable, and I am optimistic that after reviewing the facts in the hearing from the experts here today, it will reinforce this fact and the fact that something needs to happen quickly. It's taken far too long already. The effects of the Zika virus are alarming, to say the least. Pregnant women or women who have become pregnant have contracted the virus and are at risk of having babies with microcephaly. For those not familiar with microcephaly, it is a birth defect that causes severe neurological abnormalities, which can include small deformed head. This has a permanent and severely detrimental impact on the development of the baby's neurological system and quality of life. Those born with microcephaly may experience seizures, intellectual disabilities, hearing and vision loss, as well as a number of other horrific symptoms. It is our responsibility to the American people to take action when public health is in jeopardy. Although the mainland of the United States may not be worried about Zika right now, there are already 1,133 cases, and they are found in 45 out of 50 states. Just last week, the CDC reported that there are currently monitoring in the United States 320 cases of Zika in pregnant women. The CDC director, who joins us here today, called Zika a silent epidemic. As of now, many predicted what would happen in the summer. The spread of the virus is now accelerating. The Friday before last, federal health officials confirmed the largest number of new Zika infections in a single day in the state of Florida, with 10 new cases. That was a short-lived record. It was broken last Wednesday, when Florida confirmed 11 new Zika infections. That time in 6 counties, including Lake County, Florida, which had never had a case before. That record was broken again on Monday of this week, when 13 new infections were reported. And so you get the idea. The problem is only going to continue to accelerate. This is not the first time I have spoken on the growing threat of Zika. In late January of this year, as I was somewhere outside of Florida, I saw a headline in the New York Times that stopped me in my tracks. It said, "Report of Zika-linked birth defects rise in Brazil." The article went on to say the health authorities in Brazil said Wednesday that reported cases of microcephaly, a rare condition in which infants are born with abnormally small heads, had climbed to 4,180 cases since October, a 7% increase from the previous tally last week. And it stopped me in my tracks for a number of reasons. First was the staggering number and the breakneck speed with which the disease was spreading over just the course of a week. But it also made me pause because, for those of us who live in South Florida and travel through Miami International Airport, we know very well that what happens in Brazil impacts us in the United States, especially in Florida. A couple of days after that, I reached out to the U.S. Customs and Border Protection to express my concerns and ask what they were doing or could do about this, given Miami International Airport's standing as the gateway to the Americas, with more flights and passengers going to and from Brazil than any other U.S. airport. Here on the Senate floor and back home in my state, I have called for action from my colleagues. I urge support for fully funding the President's funding request to deal with this virus. I've supported every single Zika proposal that has come before the Senate, every single one, but nothing has gotten done. The problem's only getting worse. It is our duty to act now, while we can still get ahead of this disease and before it is simply too late. I believe the Congress has a constitutional responsibility and a moral obligation to confront the Zika virus. It is my hope that today's hearing will further call attention to the seriousness of this situation and what more we can do in the Western Hemisphere to help fight it. This challenge we face is emblematic of how interconnected we are as a country with our neighbors. In this global economy, public health crises do not respect international borders. The negative impacts of these problems, from the economy to political instability, can easily impact us here at home. The links between our country, especially Florida, and other nations of the Western Hemisphere are obvious. I've already covered Brazil, but for example, the first baby born in Florida with Zika-related microcephaly was a mother who came from Haiti. Last month, Time reported that 12,000 pregnant Colombian women have Zika. The Zika virus is already a U.S. public health emergency. The problem's even worse in Latin America. It's only growing by the day, and the links between our nations make this a hemispheric public health crisis, where once again, American ingenuity and innovation in the medical sciences must lead the way if we are to help save lives, including countless unborn children. We must begin to meet the Zika virus with a sense of urgency that we have not seen up to now. Listen to the experts from around. It's time to act. It's time to enact serious solutions. I am proud to stand as an advocate for any legislation that would provide funding to combat Zika as soon as possible. And we cannot rest until we've taken action in order to ensure the safety and health of the American public. Thank you. Thank you all for being here. I want to begin with Secretary Garber. Brazil's new health minister has said that there is almost zero risk of athletes or spectators contracting Zika during the Olympics. Is the threat in Brazil truly almost zero? And what advice do you feel, let me ask this, should our athletes or spectators feel fully safe in traveling to Brazil for the Olympics, given what we know about the situation there?
Thank you very much, Mr. Chairman. We are putting out the guidance based on the CDC guidance and pushing that out through all available platforms to make sure that travelers and the over 100,000 Americans that are planning on attending the Olympics can make informed decisions. We know that the government of Brazil is working very hard to address this outbreak through its own very aggressive public information campaigns and vector control efforts, including through many in the Army, hundreds of thousands, as well as public health officials to work on vector control. But I would defer to Dr. Frieden specifically on the assessment of the risk.
But Dr. Frieden, is the chance of contracting Zika in Brazil almost zero for athletes and spectators?
We recommend for any travel that pregnant women not go to areas where Zika may be spreading. So we would recommend for the Olympics, as we would for any other travel, that pregnant women not travel. For others, there are reasonable steps people can take to protect themselves. Historical data does suggest that viruses spread by this mosquito are less common in the period of the Olympics, but we think the key issue is not why people travel, but who is traveling, and the key message to get out there is that pregnant women shouldn't be traveling to areas where Zika is spreading, and if they're present in those areas, should take steps to protect themselves.
Well, let me ask it another way. Should athletes or spectators traveling to Brazil at least think about it before they go, given what we've known about how rapidly it has spread there?
All travel involves risk. It may be from a motor vehicle crash, it may be from infectious diarrhea, it may be from dengue or other diseases. We don't think the risk will outweigh the travel benefits for most people, except for the group of pregnant women. And that's why immediately after identifying Zika in the brains of affected infants, we advise that pregnant women not travel to Zika-affected areas. Also important for men who have sexual partners who are pregnant to use condoms if they come back from an area with Zika.
Dr. Frieden, what is a reasonable timetable to expect a vaccine for Zika?
We're told by the National Institutes of Health that they hope to be in clinical trials in September. That would mean that in the next couple of years we could have an approved vaccine that is both safe and effective, but only time will tell whether that happens. It is very promising. The immune response to Zika is robust, so it's certainly theoretically quite possible, but these things do take time.
You touched upon it in your statement earlier, and a lot of the focus on Zika, and rightfully so, has been through the impact that it has on microcephaly. But let me ask you, I know that there's a study ongoing with the Colombian government to study the link between Zika and Guillain-Barré. Is there anything you can share with us about the preliminary findings? I saw in your statement you said that you most certainly believe that it will prove that there is a direct link.
We've seen several studies published, one from French Polynesia. We have work going from Brazil. We expect by the end of the summer to finalize that work. I expect that that link will be proven given the epidemiological patterns, but we don't yet have two really strong independent studies determining it. That takes some time. But we've had excellent collaboration both in Brazil and especially in Colombia where we're really working side by side with long-term collaborators there.
And again, just to be clear, just so anyone who might be watching this now or later would understand, the Guillain-Barré link is on everyone. Anyone infected by Zika runs that risk beyond what we're talking about now with pregnancy, correct?
That's correct. It tends to increase with age, but anyone can be affected, and it can cause paralysis that can be severe, is usually temporary, can last from weeks to months.
And Ms. Koch, generally speaking, the health systems in Latin America and the Caribbean are stronger than those of many sub-Saharan African nations and Southeast Asian nations. And this phenomenon has prompted USAID to graduate several countries from many global health programs. But there are some groups that have come to us that are concerned that Haiti and countries in the Caribbean and in the northern triangle of Central America may be ill-equipped to handle Zika cases as well as possible related complications. What direct support, if any, are you planning to provide these countries?
Thank you very much for that question, Senator. We do very much, as USAID has a long history of supporting countries in the region, and as you noted, we did graduate our assistance from many countries, and that was following a very deliberate effort and working very closely with the governments and local partners to move away. And as you noted, it was partly because of the progress that had been made in many of those countries and the capacity had been developed. Haiti is still a country we have a robust health program in all areas, and so we believe Haiti needs additional support, but as part of our program, they've already been able to move some of the resources they have through the USAID program to get a little bit ahead and start to respond to Zika. Similarly, one of the things we are doing, particularly in Central America, which is a number of our priority areas, is identifying where some of those gaps are. Zika was completely unexpected, and it does present a threat, as has been discussed here today, so figuring out where we can fill those gaps and provide support needed.
Well, are there any countries that have graduated from the USAID health programs or been graduated in their levels that have nonetheless appeared to need additional support as a result of Zika?
Yes, some of the countries that we've prioritized, including Honduras and El Salvador, and the Dominican Republic, are all countries that we have graduated assistance from, or the robust assistance. So those are countries we believe do need some additional targeted support.
Over to Senator Isaacson. Are we providing our Olympic athletes a basic kit of repellent and whatever they need to take with them in order to prevent, the contraceptives, whatever it is? What are we providing them? Or are we working with the Olympic Committee to do so?
Yes, we're working with the Olympics Committee to provide both information and materials for the athletes for each of the different sports that are participating, each of the different associations.
Okay, thank you. As you know, I've supported the President's request at $1.9 billion. I thought we should err on the side of caution and do it as quickly as possible. I supported the 1.1, even if it was less, but it was something. I've been trying to urgently get us to do something to move funds so we can begin to address it. I was wondering if you could discuss, and perhaps this applies beyond simply the CDC, but what happens if tomorrow Congress adjourns for 6 weeks for the conventions in the summer and no funding is forthcoming? Where are the shortfalls? What will not be happening as a result of the inability to do something about this?
Well, I'll start, and my colleagues may want to say more. We will do the best we can, but this is no way to fight epidemics. It means we can't begin the long-term projects to figure out how to protect women more effectively, to come up with better ways to diagnose Zika, to accelerate mosquito control strategies, because we haven't been able to invest in those things. We also won't be able to repay the money we borrowed. We borrowed emergency money from states throughout the U.S. so that we could allocate it for Zika, not because that money wasn't important or needed, because that was the only money we had access to that we could use rapidly. And we have a gap in resources to fight Ebola in West Africa, because we had dollars that we had planned to use starting October 1 to continue to keep Ebola in control in West Africa. We're continuing to see flares of the embers that are burning from the epidemic that's over there, and all of those resources are at risk. That's why passage of a supplemental is so important, and it shows us again why having some sort of an infectious disease rapid response fund is critically important, so that we don't have to go through this the next time there's a global public health emergency, because without a doubt there will be a next time.
Yes, if I could, thank you very much, Senator. If I could just add to that, and would certainly echo Dr. Frieden that we will do the best we can, but with the resources we have, we'll be able to support the countries that I noted for a period of time, for several months during the next year, but we certainly won't be able to do very much to expand to other countries or really deepen the impact of our programs. It's enough to pay for activities running through several months, but we can't expand, and we do believe we need to expand. It can't just be the 5 countries.
Thank you very much, Mr. Chairman, for that question. It has impact for the State Department activities as well. We hope to use the money from the supplemental for targeted support for U.S. citizens, such as repatriation loans for those that may be U.S. citizens that may be affected living overseas. As a former ambassador, I can tell you one thing that gives me great concern is that if current trends of our medical evacuation of pregnant women as employees or their spouses in our posts overseas continue at the current rates, we don't have sufficient money for those medical evacuations throughout the year. That was part of the targeted money for that. And I think we have to take care of our own people. That's extremely important. And we're asking them to sacrifice by going overseas. We also hope to use some of that money for improving on communications plans in many countries and out to U.S. citizens. As we've heard in so much of the testimony today, getting the information out is so critical, and whether that's to U.S. citizens or help our embassies being able to help other governments get the information out can do so much in the area of prevention. And also, last but certainly not least, it enables us to make contributions to international organizations such as the World Health Organization. Countries look to the U.S. for leadership. If we're able to make those contributions, we know that it will stimulate other countries to do the same.
So just to summarize, if this money doesn't happen tomorrow, then we face a situation where all of the innovative work going into getting ahead of this will not be able to move forward, in addition to the risk of an Ebola or other outbreak happening somewhere in the world, and the depletion of the emergency funds at the individual state level. We face the inability to fund the work we're doing with partner nations in the region, who, if they're dramatically impacted, ultimately will impact us, because some of those cases will migrate here in search of medical care and so forth, and on a humanitarian basis. And as I've heard from you, Secretary Garber, you're saying we may not even we'll run out of funds to actually bring our people back home who are deployed abroad, serving in our embassies and consulates around the world. Dr. Frieden, you talked about the screening of blood in Puerto Rico. Are we screening blood now in the mainland as well?
The Food and Drug Administration oversees blood screening in the U.S. There are parts of the U.S. that have undertaken screening. Other parts are waiting until they have local transmission or possible local transmission. Already parts of Texas and elsewhere where they've had dengue before have screened. The screening tests are highly accurate in blood, so we want to ensure that we keep the risk as close to zero as possible.
Well, I asked from the case of Florida, obviously Central Florida, all of Florida in general, but Central Florida in particular has a very strong link with Puerto Rico, with the island. Do you know if Central Florida is screening its blood supply?
I would have to get back to you. Also, already the blood banks had, as of several months ago, begun a policy that people who have traveled to a place with Zika should defer donation. So by deferring donors, that's an added layer of safety. So people who would come from Puerto Rico, for example, would be told not to donate blood and would be asked specifically about that during that time.
Here's the last question, Dr. Frieden. If someone contracts Zika, in most of these cases, they're not even symptomatic. In essence, there are people who are carrying it today in the United States that don't even know it, either because you're not symptomatic, or if you are symptomatic, you're largely going to present at an urgent care or emergency room or a doctor's office with what looks like the flu in some cases, right? So let's just use as an example, if I were to contract Zika, the way I would manifest if I had any symptoms at all would very much mimic that of a viral infection or a flu, correct?
Correct.
And the likelihood, even if I've traveled abroad, unless I reported it or if I even showed up, because oftentimes I know these symptoms now at 45 years of age. I've had the flu a number of times. I get the shot every year now, though. But I've had the flu a number of times and other colds and what have you. And so you basically say, I know what I have. I'll just go through it. The chances are that I may not even go to a doctor, much less be tested, because as I understand it, the screening for Zika is still not widely commercially available. It would require a referral to a Department of Health to look at it specifically. It's not the kind of thing you see in a panel written up in a doctor's office. Is that correct?
Yes, that's correct.
And so the reality is that it is quite possible, and perhaps I would dare say even probable, that there is already a mosquito infection that has occurred in the United States, and we just don't know it because that person has not yet been tested. What we know is no one who has not traveled abroad and has not contracted it sexually has not tested positive yet. But we don't know if somewhere in the United States right now there is someone who contracted it from a mosquito bite in the United States, but because they're not pregnant or because they're not symptomatic or because they weren't tested because they just thought they had the flu, we don't know that it was transmitted by a mosquito.
So yes, it's certainly possible. Let me also say on your blood donation question, I want to validate the answers I gave you before, and we'll get you more information on that. But on testing, because, as you point out, 80% of people have no symptoms, those with symptoms have symptoms that are relatively mild, there is the possibility that transmission could occur without our recognizing it. That's why we're encouraging health departments throughout the U.S. to follow up on all known cases of Zika and to encourage doctors in those areas where Zika might spread through the local mosquito to be alert to the possibility and also to test contact or family members who have illness to see if they have Zika. We've also been working hard to transfer our test methods to the private sector. They're not there yet, though we've made progress toward that. So I think the scenario you outline is certainly plausible. We anticipate that it will be very difficult to identify the first locally transmitted case of Zika. This is why we need better diagnostics. This is why we need better mosquito control programs throughout the U.S.
Obviously, you can't speculate entirely about the future, but do you have personally, based on your expertise, do you have any doubt that we will see a mosquito transmission at the U.S. in the mainland United States at some point?
I think it's likely we will see mosquito-borne transmission. We don't have a crystal ball, but the best predictor is what has happened with dengue. And with dengue, we've seen clusters and isolated cases in various parts of the country, particularly Florida and also Texas. So if, since Zika is spread by the same mosquito, we anticipate that the same type of pattern may occur in addition to the unexpected sexual and potentially other means of transmission.
And my last question with regards to this is, does it make any sense at any point in time from a medical perspective to add a test for Zika to the normal screening or the panel that would be administered to someone the way you would put some other infections or other diseases or other viral infections on a normal panel for a blood test?
At this point, probably not, for a variety of reasons. If in the future we were to have a test for prior infection with Zika, that might give us some useful information, but we know that if you have a test applied where the positivity rate is low, you'll have a large number of false positives, even if the test is a good test.
I'm sorry, there is no, the only way to confirm a Zika diagnosis is through a blood test?
Blood and urine.
So it also appears in other fluids?
There are two, broadly speaking, there are two types of tests for Zika. One that looks for the actual virus, the RNA of the virus, and that can be found in blood or urine for about the first 2 weeks currently after infection, or a test that checks for the body's reaction to the virus, the antibodies, and that becomes positive within the first week or two and generally stays positive only for about 8 to 12 weeks.
Yeah, and the reason why I ask only is because I was just wondering if at some point, as part of the research that's being done, it's possible to create some sort of quick, painless, I suppose, ideally, a point of entry test that could be applied to travelers coming into the United States, but obviously if it's through blood, you're asking them to submit to having blood drawn, which is, and having someone undergo a urinalysis at an airport is not the best way to welcome them to the United States. But
we have about 40 million trips to and from the U.S. to Zika endemic areas, and perhaps 200 million overland or other trips. Theoretically speaking, if a few years from now we have a good test for prior infection and a vaccine, you could imagine a situation in which travelers leaving the U.S. would want to find out if they had immunity, and if not, and potentially would become pregnant, get a vaccine. That's very theoretical.
We've run long, so my last question, I promise this is the last question. If someone has traveled abroad to one of these countries where Zika is present, and they've either had relations or have been bitten by a mosquito or think they might have been, how would they get tested? Could their doctor order a test?
Any doctor in the U.S. can contact their local health department. We've already distributed our test and trained and supervised labs around the country so that most state health labs already can do this test, and those that don't can send it to CDC labs to have done. So again, in the first 2 weeks, there's one type of test. From 2 to 12 weeks, another type of test. If people, particularly pregnant women, are concerned that they may have an infection, they should be tested. And people with symptoms of Zika who've traveled should also be tested. And those tests are available. As you indicate, if we could get them into the private sector, they would be more widely available. And we're doing that as rapidly as possible. We actually got Food and Drug Administration approval to do that within the past week. We've already shipped the materials to private labs, and they're now undergoing the validation so that they can be comfortable in doing this and providing the results.
Well, I want to thank all three of you for your time and for being here and from the attendance today. Obviously, on the subcommittee, there's clearly an interest both among our members and the general public. Before we conclude, I'd like to include a study conducted by the University of Florida, the finest learning institution in the southeast United States, from Dr. Glenn Morris as part of the hearing record. That was a point of personal privilege. And the record for this hearing was going to remain open until the close of business on Friday, and with that, the meeting's adjourned.